Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we are back. And if you're joining us right now, we are getting our first conversation for this morning started. And we are joined by Dr. Andre Sosa, who is the chairman of the board of the K.H.M.H.A Memorial Hospital. And we are going to be talking a little bit about some of what's going on at the hospital right now. Good morning, Dr. Sosa.
Good morning, Gavin. Good morning, Marlene. Good morning, viewers.
Yeah, and thank you so much for joining us. We appreciate it, especially because we know there's a lot going on at the K.H.M.H. right now. And perhaps we can start by talking about what has been making news a lot recently, and that is the departure of a large number of nurses from the hospital, or the imminent departure, I should say. And let's start by talking a little bit about that situation and if we should be concerned.
Okay. First of all, there's always a lot going on in K.H.M.H. It's like a little city, and people don't often appreciate all the moving parts that are in action there. So that is something we're already accustomed to. The situation with nursing is indeed one of concern, and that is in the context of the COVID-19 pandemic. There is always movement of nurses, but what we are seeing right now is a confluence of a number of different factors, including the fact that there is very aggressive recruitment going on in the United States, in the UK, primarily, where there is an acute shortage of nurses as well. This is a worldwide problem. So with the greater facility for movement now from those countries, we are seeing a number of the nurses working here presently moving out. That includes Belizean nationals, as well as expatriate nurses who had been recruited previously here. Unfortunately, all of this comes at a time when some issues have come to the head as well. There is a great deal of dissatisfaction, I should say, primarily amongst the Filipino nurses here, but also other foreign nurses who are seeing attempts at enforcing regulations with regards to licensing. To be fair, this is an issue that has been going on for at least the last couple of years, but what is being said is that there are attempts now to try and enforce those regulations. Obviously, it's not an opportune time for this to happen, and we believe at K.H.M.H. that is part of what is creating dissatisfaction and is spurring an even greater number of nurses to depart from our institution.
What's the number that we're looking at right now?
Well, to the 31st of May, we are looking at 21 resignations of nurses. There has been an aggressive recruitment effort, and we have managed to recruit 12 full-time nurses and 7 part-time nurses. Mm-hmm. To the end of June, we foresee that there will be at least 12 more resignations. We hope to be able to fill the gap with the graduating class of nurses from UB. We are told by Nurse Bell, the Chief Nursing Officer, that there will be 40 graduates, and that priority will be given to the K.H.M.H. to be able to recruit these nurses. There are no posts available in the public sector, and that gives us at the K.H.M.H. a certain advantage to be able to recruit at least a large number, we hope, of these nurses. But we also have an externship program at the K.H.M.H. And what it is that we hire or we create positions for these nurses who have graduated but who are still waiting to take their exams. Presently, there are 8 positions for these young nurses. The board has recently voted to expand the number of positions to 15. So that is a stopgap measure. But also we have temporary positions for PCAs, primary care assistants, and that also helps to some extent. So if the situation does not deteriorate in terms of the COVID pandemic, then perhaps we will be able to fill the gaps. The problem, however, is if we have a full-out outbreak of COVID, whereby we will need to staff the COVID unit, and then we would be looking at a need for at least 30 more nurses.
And will they be available in country?
Probably not.
Well, that's a question I have. So, you know, as the chair of the board, have you made a recommendation to the Ministry of Health as to whether or not enforcing the measures are at this time is the best timing for the country and for K.H.M.H.? Couple of things that I want to make clear. So the foreign nurses, the nurses who come to Belize, mostly Filipinos, Nigerians, the K.H.M.H.s come through the Cuban Brigade. Now, they have come into the country and they started working without taking the licensing exam. So they have been practicing. Enforcing it now mid-pandemic seems a bit rigid, understanding that there is a greater need for them. Do you share that opinion, and have you made a recommendation that this is perhaps not the best time to move into formalizing what is the standard?
Well, suffice it to say that we raised the alarm with the Ministry of Health from December of 2020 because, well, we were alerted to this problem by the union at the K.H.M.H. and by some of the Filipino nurses as well. So it is a problem that we have been trying to get solved. Unfortunately, given the regulations for nursing, this is a problem that we at the K.H.M.H. can't solve on our own. This is something that has to come from the ministry and from the Nursing Council. In principle, we agree with what the Nursing Council is attempting to do, but yes, it is frustrating for us that it is being done at this very moment when we who are tasked with the responsibility of providing the treatment for COVID patients might find ourselves in a very precarious position. In 2020, we saw a large volume of patients. Actually, to date, we have treated 218 patients for COVID, and we are very conscious that if we are indeed at the beginning of a third wave, that we might go back to the precarious days of middle of 2020, when the COVID outbreak was at its worst, at its height.
So that's one of the issues with the nursing shortage that has come to a head. Now, Dr. Sosa, you know, this has not been a problem of today. The nursing shortage has been an issue for a very long time, and not unique to Belize either. When you look at the currently employed staff at K.H.M.H., it still isn't sufficient to cover the needs of the patients there when it comes to the nursing staff. What is your hope that, having had this conversation now in the public, that the issue has really come to a head? What is your hope in being able to remedy the situation?
Well, I think one of the measures that the Ministry of Health and Wellness has taken in the last month, which is to announce 50 scholarships for nurses, that's a step in the right direction. Mm-hmm. And it is something that needs to continue every year, and indeed it needs to be increased. There is a pressing need for not only nurses, but more doctors, mm-hmm. more physical therapists, x-ray technicians, lab techs, and so on throughout the country for the health sector. And indeed, there is a large number of unemployed young people who would do well with having those positions and those posts available to work and to be productive members of society. So that is a step in the right direction. With regards to your previous question about how to deal with the impending surge, certainly we need to redouble our efforts, the necessary measures to contain and control spread. That is something that we have advocated about in the COVID task force, of which I am a member, and we have several other persons from K.H.M.H. Present. Now, the other issue is the need to urgently increase the vaccination process in this country. We need to urgently expand vaccination to the entire population.
Yeah. Now, it is, as we talk about the issue of nursing shortage, that's one aspect, but the other conversation that's brewing coming out of K.H.M.H. is looking at the changes that are taking place at the management level. This is the CEO, the director of nursing. I believe you had 2 other senior management staff that are leaving the institution. Now, you're new as the chairman. You assumed that role a few months ago. Explain to us why this is happening now.
Well, I have been at the K.H.M.H. for 20 years.
Yes.
So I have had the advantage of living and seeing the problems that exist within the institution. It is an institution that necessarily must undergo rejuvenation every so often. If we look at the fact that from 2016 to today, there is $35 million of outstanding bills that have not been paid. If we look at the fact that just in 2020 alone, there is $9 million of bills that have not been collected. Certainly it was a pandemic year, but if we take the trend of so much money not coming back to us, then it's a crisis. It's a crisis perhaps in slow motion, but it is a crisis nonetheless. And the board feels like it is necessary to shake things up. It is necessary to get a new energy from all the directors in the institution, because we have big dreams and aspirations that are the dreams and aspirations of the Belizean public. The COVID year has taught us that we need to be able to solve problems in country. And to be able to solve these problems, we need to bring up the level of the hospital. And that can only be done with investment, both in terms of monetary investment, but also investment of people, of qualified persons. So that is why the decision has been made that across every aspect of the management of the hospital, that everyone will have to submit themselves to scrutiny before they are able to have a job.
Now, and I know, so we can clearly state that you will say that these contracts were coming to an end this month and within the next few months as well. But from the outside looking in, after a change in administration in the government, people oftentimes will see this as a political play where politically connected persons will be brought in place of these persons who are leaving. How do you respond to that?
Well, you know, that is to be expected. That is true not only for Belize, but across all democracies. Certainly, that is not the spirit in which I see these things. I come from a clinical background, and my commitment to the public is that only the very best people will be able to attain those positions. That is my commitment. I do welcome the scrutiny. Indeed, I wish that more scrutiny can be had, not only for the K.H.M.H. board, but all the boards that operate across this country. So I welcome the scrutiny. And, you know, they say the proof of the pudding is in the tasting. You know? So we look forward to being held to that higher standard. I think that I can say right now that in July of this year, we plan to do the first kidney transplant in the K.H.M.H., the first kidney transplant in this country. That is where we are looking to go, to provide those services that previously were unavailable in this country. And we can't do that with a wishy-washy attitude, with the just good enough for Belize attitude that has prevailed in this country.
So you were dissatisfied with management?
Well, the fact that we are opening up these posts is not in any way a reflection of dissatisfaction, but rather a need to step up to a higher standard. And all the persons whose contracts have come to an end are welcome to apply again. What we want is a new vigor, a new enthusiasm, and a new way of doing things.
One final question on that issue. How do you respond to the fact that perhaps any management of K.H.M.H. will be a victim of the very unique position that K.H.M.H. is in, which is it's a statutory body. It's referred to as a national referral hospital. You made a clear distinction earlier about public sector jobs versus K.H.M.H. jobs. But it's treated very much as a public hospital. And all the tertiary care, sometimes even secondary care patients end up at the hospital. Bills are hard to collect on. So there's a perception that it's a public hospital when in fact it's not. It should be functioning more along the lines of a private institution. So any management who comes in, they're battling the perception of an entire country that you can just go to K.H.M.H. and get your service.
Yeah. Well, and that is precisely why we have to do things differently. Mm-hmm. We want to create a public-private partnership, which might mean having to go beyond the borders of this country to seek those partnerships. And that is something that we have contemplated. Naturally, that means a different mindset. And I will share with you and with the public that our hope, our goal, is that at the end of the next 5 years, the next 4 years, we will have a new building on the K.H.M.H. compound. We are at the start of the hurricane season, and the present facilities at K.H.M.H. are rated for not more than a Category 2 hurricane, meaning that if there's a Category 3 or more on the way, we have to move everything. The reality, though, is that our district, there is no capacity to treat or to deal with patients from the ICU, adult ICU, neonatal ICU, pediatric ICU. So that puts our patients in very grave danger if there's a need to move them. That is a situation that has to be remedied. And it will be remedied by constructing a hurricane-resistant multi-story building outfitted with all the best equipment. That is where we need to go. And so we say that a new mindset is needed. It can't be business as usual. Business as usual was okay for the past, but it's not okay for the future.
Where do you imagine the money will come from to be able to construct a new building at K.H.M.H.?
Well, we are looking at partnerships with foreign countries. We are looking at partnership with foreign foundations that have already expressed in the past an interest in partnering with us. Of course, that means that there has to be scrupulous management of funds, and it needs careful consideration and guidance. And that is why there is no place for political interference. It has to be above board, and which is why I'm saying that we are open to scrutiny. There has to be full scrutiny. There has to be full transparency. Otherwise, it won't work.
And are there any, well, I mean, those are some long-term goals. Are there anything short-term goals that you hope to realize or changes that you would hope to see that might be galvanized by perhaps some of these changes that are ongoing?
The first changes that we made were in the medical management of the hospital, because I believe that it's unconscionable that we should have patients dying in the parking lot of the K.H.M.H. So changes were made to the medical management. Those changes are ongoing. We have the situation where oftentimes patients go to the K.H.M.H. and they are not able to access treatment because X or Y specialist isn't available. Under the able guidance of our Acting Director of Medical Services, Dr. K.H.M.H.A, we are setting in place measures to be able to make a wider range of specialists available for the public. I think that you are all aware that towards the middle of 2020, we lost services for the dental surgeon, for one of the supporting intensive care specialists, and for the ophthalmologist. We need to recover those services, and that's what we're looking at. So certainly, it starts with the medical care that we give to our patients, but also above and beyond that, we are looking to increase our cooperation with foreign partners like PAHO, also having closer cooperation with the Ministry of Health, looking at more integrated management of disease conditions like diabetes, hypertension, dialysis treatments, and so on. So we are looking to take medicine to a more profound level. And part of the efforts that we are undertaking is to reform the training of our doctors and indeed of our nurses within the institution. My hope, my dream is that we will convert the K.H.M.H. into a true teaching hospital. Nice. So that will bring up the level, but also not only training our nurses and doctors and other personnel in the art of medicine, but also looking at our interaction with our clients, with our patients. Our focus will be on human rights, because if you understand what the human rights of your patients are, what the human rights of the workers of our institution are, I think we will be in a better place. But also looking at ongoing and constant customer care training, which has been one of our weak points, admittedly.
And what about being able to ensure that you can collect for services offered at K.H.M.H.? I know you've worked with K.H.M.H. As a specialist, as you said, for 20 years, but you also know that the difference between K.H.M.H. and the private sector is that you must ensure that you can pay for your service in a private sector before you get specialized care. In the K.H.M.H., especially when you're talking emergency, it's not the same. How do you imagine that you'll be able, one, to collect on outstanding debt, but also ensure that moving forward, people can still get treatment without being having to be forced to prove that they can pay?
Well, you know, admittedly, some people just won't be able to pay. And we have to be sensitive to that, and we have to find a way so that those people who can't pay their portion is covered from other areas and from other people who can pay. A big part of the problem has been ours. We haven't been diligent enough, for example, to collect from clients who have insurance coverage. That hasn't been pursued adequately. We also provide services to workers who are injured in the line of their work and who are covered by the Employment Injury Scheme. We haven't been diligent in doing that. So what we foresee is a big shakeup of the collections department of our hospital, and indeed the finance section of our hospital. So a lot of internal reform has to be had, and the message is clear now that we have to have a different attitude, and we expect more from our employees.
Now, Dr. Sosa, with all your experience and your time that you've worked at K.H.M.H., you know, it's always a dream that it will become the type of tertiary level institution that the country deserves and needs. Tell me what motivates you to take the time to be able to get us there, and whether or not it's practical that we'll be able to reach that within 4 or 5 years.
It must be an ongoing process, and I've talked the talk like a lot of my colleagues, and now I'm walking the walk. I grew up in an era where there was a mindset. I don't want to say socialist, but indeed we grew up in the era when George Price used to visit our schools. I don't think that all of us can say that, but yes, I was a primary school student when George Price, the Honorable George Price, would visit our school. And, you know, we were instilled by an attitude of service. We grew up in the time of when Zimbabwe became independent, when a lot of other countries became independent, and there was this optimism about third world countries being able to progress to a better place. That feeling lingers, and it's shared by a lot of people of my generation. We are the people now who have to push. And so there will be others who come after us who will have to take up the mantle, but now is our time to really and truly push the agenda along, the agenda for development.
And you mentioned it earlier, it's worthwhile exploring further. The first kidney transplant will take place at K.H.M.H. Tell us about being able to put that together and the significance of what that will have in the country.
As I said before, we have endeavored to bring to K.H.M.H.A professionals who previously were not available for us. We are lucky to have with us Dr. Byron Simmons, who recently returned from Mexico, where he did training with kidney transplant. We have a number of other talented doctors in country who are supporting this effort, and with the coordination and guidance of Dr. Koyi, we are going to make that happen. So it's, I think, a natural progression from the dialysis service that are presently available. There are dialysis units popping up all over the country. Kidney disease is a big problem, as you all are aware, not only here but throughout Central America. You know, people are tied to dialysis, which is hugely expensive, and we want to free them from that. That is at one end of the spectrum, but we also need to focus on the basics as well, which is why we want to partner with the Ministry of Health to better coordinate management from nutrition to medical care of of kidney patients, and so on. No? So we're looking at both ends of the spectrum, but we are also trying to solve in-country problems that before were out of our reach.
Yeah. I don't think a lot of people realize that for many people dialysis is long-term. And in fact, the only way they would come off dialysis is through a kidney transplant. Has the patient been identified already?
Yes, Marlene, identified. The necessary tests and preparations have been made. So we are very close to executing the process.
Big achievement. Now let's talk about COVID before we start to close off. We are looking at an increase in cases at this moment. We're about over 150 active cases. Not where we have been in the past, but definitely moving in the wrong direction. What is the preparation currently taking place at the K.H.M.H. in the event that we see the type of surge that we saw at the end of last year and beginning of this year?
Well, we had to reopen our COVID ward the middle of last month. Presently, we have 3 patients, confirmed cases admitted. We are on standby for expanding to the overflow areas if necessary. Obviously, with 3 patients, that isn't necessary yet. So we are vigilant. We are prepared.
Number of beds available?
We can expand to a total of 43 beds with all the different areas and spillovers.
Okay. And for intensive care, those on ventilation that?
Well, you know, we recently got from the Ministry of Health and Wellness through the help of our minister a number of different ventilators and the necessary support equipment. So right now we have the necessary numbers of ventilators for research. We are certainly in a far better place than we were last year. The big issue, as we said previously, is with numbers of nurses. If the cases do increase exponentially, what happens in those cases is that as we need more and more nurses, we have to close down other areas and pull nurses from those areas to cover. That is not an ideal situation, because if we have to close our patient clinic, for example, then that means patients have to wait longer times for their surgeries. Patients who might be unstable with different conditions might not be able to get their treatments in a timely manner, and because of that, we tend to start to see complications down the road. So we hope that does not become necessary.
And the vaccine status of the K.H.M.H. workers, doctors, nurses?
I think we're at about 87 or 89% vaccinated for our staff, which is pretty good, I think. No?
Yeah. Any closing words, Dr. Sosa? The microscope is on K.H.M.H. at this time, and you said you welcome the scrutiny. What do you say to the public who are very reliant on quality care that K.H.M.H. can deliver?
To be patient with us, that they should not be alarmed by what they see. It is a rejuvenation process, but that the purpose of that is to make sure that they are able to get the kind of care that they see on TLC and Discovery Channel and all those medical shows that people love so much. That is where we want to go, because COVID has taught us that when the borders close, we have to solve our problems nationally. And you know, we are coming on the 40th anniversary of independence. It's about time that we as a country are able to handle our candle, as the saying goes. It's not enough to say we are independent. We have to prove we are independent. We have to be rid of this colonial mentality that somebody will come from outside to save us. Certainly we value our international partners, and that is always important, But in the end, we are responsible for our own country, and we have to do our utmost best to make sure that every day we work to make that happen.
Well, we appreciate you coming in to tell us about what is currently ongoing. We know the nursing shortage is the big issue, and of course the concerns with the management staff, but definitely we can only wish you the best because it is such a critical part of our healthcare system in this country.
Thank you very much.
Thank you. And with that, we're going to go ahead and take a break. When we come back, we'll be joined by the outgoing Chargé d'Affaires of the U.S. Embassy. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.